Hi Laura, it's nice to see you.
Hi, Harry, and you.
Yeah, no, it's for colleagues. What we're going to do today is just a very brief interview with Laura. You may have picked up that there's an advert out for the Scottish Clinical Leadership Fellows, and Laura, now being the director for the General Pharmaceutical Council in Scotland, was one of the first cohorts, and particularly from the community, to go through that programme. So I'm going to take a wee bit of time just to pose Laura a few questions so that she can answer you and hopefully maybe entice you to apply for such of these things. So Laura, that gives a bit of the background. Could you maybe tell colleagues in the community sector what it was like to go through the Scottish Clinical Leadership Fellows Programme?
I certainly can, Harry, and as you can tell, it's a bit of a mouthful, so we might just cut it down to scale for the process of this.
Yep.
So for me, the Clinical Leadership Fellowship was a real opportunity to really understand a bit more about the makings of the NHS in Scotland. And probably what attracted me to it at the time was the fact that there was an opportunity to do a project based around community pharmacy and what we now know really is Pharmacy First Plus, and some of the elements about becoming that first port of call. I think the fellowship itself was a real opportunity to get to understand a bit more about me personally. And that was very much in the leadership development area. So it was a 3-day-a-week programme. 2 of those days were kind of spent doing project work, and one of those days was usually spent doing some leadership development. And at the same time, doing my day job to just keep my hand in as to what was happening in the community at the same time. If I think about the year itself, I was on the programme as the first cohort of pharmacists involved. And with that comes challenge, because when you are the first of something, nobody can tell you what it's like beforehand. But we got involved with the medics, we got involved with the dentists, and there was 18 of us in total, where we met up on a monthly basis to do some development, but also just kept in touch with people about the project itself. So what was the actual programme like? It really was a delve into me as a person, and I did a bit of work around the kind of key skills and attributes I have, some areas for development, one of which still continues to be active listening, and already you can probably tell I talk too much, but that's just the way it is. It was an opportunity to understand things like leadership and the important qualities that come out from that. There was elements of motivating your team and thinking about how teamwork can have a real impact. And if I bring it back to community pharmacy and the passion that I have for that, it really helped me to really see where some of this leadership development could be useful as we take the profession in a new direction. So about understanding what makes people tick, what motivates people, and from that, having that knowledge and understanding really gave me the confidence to go and use the skills I'd learned.
Yeah, and certainly I know, Laura, this year there's an opportunity in terms of the project. One of them is around substance misuse. And I know Scotland's drugs deaths is not where we want it to be. So I think that's an ideal opportunity that could attract someone from the community. I know, as you said, yours was about NHS Pharmacy First, etc. So it's not exclusive. There are other projects, etc. going. But I think if I was trying to encourage our colleagues from the community to come forward, it would be around the leadership bit and what you learn and what it prepares you for going forward. The projects, I was being honest, are nice to do, but actually the real value that's added is through the leadership things and the people and events you're exposed to. So any kind of comment on that for the colleagues?
Yeah, I would actually agree. And having reflected a bit on my opportunity to do the project, it absolutely was a nice to have and good to do, but it was not the driver for why I wanted to do the leadership fellowship. Certainly the time spent really delving into your character, really understanding some of those characteristics of leaders and being exposed to leaders in both the pharmacy world and the wider world was useful to then think about how I could put that into context. And just picking up your point about the project, I would actually encourage people to apply for any project, because there's something really exciting about doing a project that you really don't have any knowledge in. Sometimes knowledge can hinder your ability to look out with what you know. And on reflection, doing the NHS Pharmacy First project was good, but there was one round digital and the opportunity to use that in pharmacy. And looking back, I might have been more keen to have a go at something like that because it was the unknown. So I wouldn't say to colleagues to be put off by the fact that there is one that has been linked to community pharmacy, but in actual fact, look at them for what they are and how you could expand your knowledge. Substance misuse certainly is an area that would be exciting to do, but I think there's ones on pharmacogenomics and different areas which are really forward thinking. And what it does do is expose you to different people within the profession and out with the profession that you can link up with to then build your networks and move things forward as well.
And would it be fair to say, Laura, that going through the programme helped prepare you for doing your current role in terms of director for the General Pharmaceutical Council and going forward? Any comment on that bit?
Absolutely, Harry. I absolutely 100% would not have applied for the Director for Scotland role at the General Pharmaceutical Council had I not gone through the Leadership Development Programme. Part of that may be my confidence in myself, but another part of it is probably to do with the fact that some of the networks that I built over the year would not have been as well established had I not done the programme. Some of the skills and attributes that I've developed as a result of being on the leadership programme have really helped me in this role, particularly when we've been working in this virtual world where chairing meetings, managing stakeholders, being involved in big conversations would have been more daunting had I not had some of those tools that I'd gained on the fellowship under my belt.
No, great stuff, Laura. And I think that's really a nice synopsis to close on for colleagues in the community. So can I really just encourage you, what you've heard from Laura, I hope that's given you some enthusiasm to apply. As I say, have a look at the advert. It tells you that it includes community pharmacy, and you just need the backing of your pharmacy owner to come on board or at least apply. There'll be a process, you go through an interview, etc. Not to be daunted by that. And I can assure you there will be people on the panel that know a fair bit about the community sector, so don't be off put by that. So Laura, can I just thank you very much for your time, sparing that to speak to us and our colleagues across the network, and we'll be back in touch. Thanks, Laura.
Thanks, Harry. On a final point, if anybody is interested in the programme and wants to get in touch with me, then please do. I would love to have a conversation with you about some more of the detail and what to expect, and that's no problem at all. But please do consider it. It's made a huge difference to what I've done in my career to date. Thank you.
Thanks, Laura.